because a big factor about brain drain really has to do with compensation and the financial side of compensation. So that as you had during the conference, someone mentioned a nurse working in Malawi earns about $400 and they could go to the US and earn $3,000 a month. So that it's really a no-brainer at that point where to go. But then what can keep them here? So I guess it goes back to us within the health sector in terms of looking at what are the other ways of compensating people, rewarding people within the system. That yes, there is the financial side of it where there is the money, the basic pay, but what about the other non-relational things? What about in terms of building their career, the career path, in terms of training opportunities, in terms of work environment, in terms of, autonomy in the environment, the sort of things, the other non-relational things which don't necessarily cost more, but which can motivate one to remain in a place. Recognition. So when it comes to the basics, of course the basics must be met, because whichever way, someone has to feed their family, they have to feed themselves, they must be able to clothe themselves, they must meet their basic needs. But maybe in terms of restructuring compensation, let's look at also more the non-relational things. That's one way, that looking at compensation as being both financial and the other non-financial aspects. But another key bit in terms of retaining our staff has to be with our strategy in terms of the health sector. What is it that we want? The number of nurses we want, and then that if these are the certain number of health workers that we want, then and in how do we distribute them, then work towards strategies to keep them in those places. Maybe part of the problem right now, much as we say there's a shortage of health workers, we find that there's an excess of health workers in some areas, but shortages in other areas. So then again, also then in those areas where there are shortages, what can we do to keep them there? And some of it may be just even literally changing the work environment in that place. Those are some, off the top of my mind, some of the things that I think we've mentioned within there. And then also targeting the different levels of the generations, because we are looking at now, we are past the XYZ generation, we are into Alpha, and basically there are people who want to work in a very different way. What opportunities are there that we can provide for them so they don't have to necessarily go to the traditional stuff? And one of the disruptive technologies that we are looking at is like teleradiology. That yes, they're in the health sector, they are radiologists, many of them who want to remain in Nairobi because that's where all the other comforts are. But then the services are needed elsewhere. So some who have been innovative have just decided, fine, all I need is a link, a computer link, internet link to a facility at a distance, and then they can actually read the radiology reports, report them and send them off. So I think a lot of what we have to think about is just transforming our minds and getting out of the box thinking and looking at how can we nurture and retain our talent but from a different perspective, not just from the point of compensation, but in terms of even what else they can do. And the disruptive technologies come there, dial a doctor, there's a whole lot of different things, and some of those we can harness from the new generation. They are not the ones who are ready to sit and be in the public service from step one and grow up the pay grade until retirement. They want what is at the top right now. Well, the three key things basically would be a compensation and reward system that is clear, so that you know clearly that yes, this is the financial side of things, but from a non-financial bit, this is the way my career progresses and moves on. So that is in one area. Another bit is, of course, then looking at what are innovative ways of working wherever that talent is. That for radiologists, for example, that they can work what we're calling teleworking or teleradiology. That's an option. And then, of course, going back to in terms of infrastructure itself, it's one of the things that will make people move away. Basically, the working environment. That yes, you need the equipment, you need the leadership, you need all the things within that environment to keep you there. So Yes, it's not just the money, but the environment within one works, but also what other innovations around the working area that we can work with.